Well, there's a plan to improve health equity here in Michigan. At the start of the pandemic, it became clear that communities of color were being hit harder by the virus. Paula Tutman is live this afternoon at Wayne State with the results from a task force that has spent the last 2 years trying to fix this. Paula.
Yeah, hi Karen, hi everybody. Really interesting stuff. First of all, I just want to kind of set the table for you and where I am. This is the Integrated Bioscience Center at Wayne State University. News conference held here today, ostensibly because certainly Wayne State University had a partnership with the Michigan Coronavirus Task Force on Racial Disparities. Had to read it. Long name, lots of information, but at the end of the day, what the Whitmer administration is saying is, you know what? Coronavirus, bad thing, but they sure learned a lot.
Wow, this is the first time you guys are really doing that. Okay.
Right.
That's
First
great.
time we're doing it.
A model that works at a time when the state was desperate for solutions and things that worked.
Ms. Dixon is starting a movement.
Yes, she is.
And that movement is we have people who are homebound who can't necessarily get out to get their shots, and we have to go and give their shots to them.
This is video of healthcare providers in the homes of seniors fighting the pandemic, a household at a time. And it turns out that model works to close racial health disparities across the board.
We are not saying that race is a risk factor. This is not about blaming a particular community. Quite candidly, race is not the risk factor. Racism is the risk factor.
COVID is and was bad, really, really bad. In the early days, before we knew what it was and how to possibly hold a novel coronavirus at bay, lots of people lost lots of people, including Lieutenant Governor Garland Gilchrist.
I lost 27 people to COVID-19 in my life, like real relationships, my basketball coaches, my pastor. The oldest member of my family on my father's side.
And Deanna Solomon of the Detroit Area on Aging.
I lost 21 people that I knew.
And in fact, the national numbers told a terrible tale of Michigan, with as high as a 30% infection rate in some places, where minorities only made up 14% of the population. And so that is why the Whitmer administration launched a racial disparities task force to take a look at why COVID was so particularly dangerous and deadly to communities of color.
One of the things we found, and this was nationally, is that more individuals of color had employment in the types of jobs that made them more front-facing, that made them have more interaction with the public. So in food service, for example, in healthcare.
And it turns out that in launching that task force and modalities of care that addressed those things that affected minorities most, not only was this state able to create a model of care that reduced deaths, but also addressed the root causes of the other things that were killing minorities. The Detroit Area on Aging also used its established, trusted connections with the elderly in numerous communities to go into homes with vaccines and handle everyone in the house.
What we also layered in is that we served everyone in the home, every adult that was 18 and up. So not just seniors, but their caregivers and then their family, because we wanted to protect the whole household.
Okay, so what happens to that task force? Well, as of today, it pretty much goes away as far as it being its own entity. However, it really does spread. The things they learned, the data collection, those kinds of things will really spread out throughout the state in different arteries and in different ways. Coming up at 5, though, I do want you to stay with me because there's an interesting juxtaposition here, simply because everyone knew there were health disparities. That was no big surprise, but it was those health disparities that were actually addressed and the things that they learned that really will be spread out throughout the state to close those disparities. So I hope you'll join me. Stay with us until 5 o'clock. Karen, back to you.
We look forward to that. Thank you, Paula. We'll see you back at 5.